Okay, very important story here. Happening tomorrow, you can wear red to raise awareness about the #1 killer of women, heart disease. Jane is with Fort Myers neurologist Dr. Mowzoon to talk about National Wear Red Day and what you need to know about this disease.
All right, Chris, I already have my red pin on. It's a little red dress there. Good morning, doctor.
Good morning.
And so what is the significance of wearing red tomorrow?
So this is meant to raise the awareness for incidence and prevalence of stroke and heart disease in women.
All right, yes.
And the mortality that's associated with it.
Do they go hand in hand?
They do go hand in hand. Once we develop heart disease, once we develop arterial disease, those arteries are in the heart, they're in the brain. So once we develop that cascade of disease in the arteries, then we can get stroke and heart attacks.
Talk about how common it is in the U.S.
Well, both heart disease and stroke are fairly common. Every 40 seconds, somebody in the United States has a stroke. And the prevalence and the mortality, meaning the incidence of death, is quite high, particularly in women. In women, there tends to be a situation where, although men have a higher risk of stroke, for instance, women have a higher rate of death, or mortality as we call it, meaning that we know now that 1 out of 3 women die due to complications of stroke and heart attack. So when stroke and heart attack occur in women, they tend to carry a higher rate of death. They're more significant.
Okay, you work out of Southwest Florida.
We do.
And you have some technology that can help detect some of the signs or treat the symptoms of a stroke.
Correct. So in our company, which is TeleSpecialists, we have the technology where we put robots into different hospitals across the United States. And we can actually, when the patients come into care, we can actually see them almost immediately and help to treat them with the ER team.
All right, very good. Quickly, a couple of signs to watch out for a woman suffering from stroke.
Sure. So in terms of both stroke and heart attack, the signs and symptoms can be, may not be the common signs and symptoms that we think about. For instance, with heart attack, most women may not get chest pain, but they may get neck pain or arm pain, nausea. They may all of a sudden get sweaty or just not feel well. And for that reason, a lot of times they don't come to care, and that could be one reason why they have a higher rate of death. Same thing with stroke. A lot of times the signs and symptoms of stroke are not the most typical signs and symptoms that we think. They may get altered mental status or headache or nausea.
All right, so you've got to pay attention to your body and don't just dismiss it. Don't forget to wear red tomorrow. We will all be wearing red in honor of National Wear Red Day. Thank you, doctor, for coming in. Appreciate that.
Thank you very much.